bone landmarks of the foot. And first is going to be the first metatarsal cuneiform joint. You're going to find the head of the first metatarsal, and it begins to flare out where the base is, where the cuneiform bone projects. And your navicular tubercle is, you're going to move proximal along the medial border next to the large bony prominence, and that's going to be your navicular tubercle. And the head of the talus is immediately proximal to the navicular tubercle. And if you evert your foot, and it causes it to project outward. And then your medial malleolus is going to be just proximal to the distal end of the tibia, and it's going to be your large bony prominence right there. Your sustentaculum tali, you're going to move plantar forward about 2 centimeters from the distal end of the medial malleolus. And it's going to be small, and it serves as an attachment site for spring ligaments. The medial tubercle of the talus is barely palpable, but it's immediately posterior to the distal end of the malleoli.
Now I'm going to palpate the lateral aspect of bony landmarks of the foot. Start with the fifth metatarsal, which is on the lateral side of the ball of the foot, and you're just going to follow it all the way down the lateral side of the foot. And at the very end of the fifth metatarsal bone is the styloid process of the fifth metatarsal bone. It sticks out, so it's pretty easy to find, and it's the insertion site of the peroneus brevis. Next, we're going to just keep moving backwards and to proximally along the foot, and on the lateral border in the posterior portion of the foot is the calcaneus, right around here. It's a really large bone, easy to find. And if you just move up, it is the lateral malleolus, and if you just go plantarward down, and it's in between the calcaneus and the lateral malleolus, you'll find the peroneal tubercle, which separates the peroneus brevis and longus tendons.
Okay, I'm going to palpate the sinus tarsi area bony landmarks. The first one is sinus tarsi. It's going to be inferior to the lateral malleolus, which is right here, and the sinus tarsi is going to be right in this area right here. The dome of the talus is going to be more medial. You're going to have your patient invert and plantar flex the foot. It's not really very palpable, but you can palpate a slight depression over it. The inferior tibiofibular joint is proximal to the talus. This one is also hard to palpate, but you can feel a small depression.
So first we're going to find the dome of the calcaneus. First you just find the calcaneus bone, which is the large prominence at the edge of the foot, and you're going to go superior, and the bone that's protruding is the dome of the calcaneus, and you can feel it right around here. And next we're going to find the medial tubercle of the calcaneus, and it lies on the medial surface of the calcaneus, and it's on the plantar side. It's very large and protrudes outwards because it's an attachment site for the adductor hallucis muscle and the flexor digitorum brevis and plantar aponeurosis. Now we're going to do this plantar surface bony landmarks. And first we're going to start with the sesamoid bones, and you're just going to palpate along the arch right here, and it's going to be right at the first metatarsal head, and you're going to feel 2 bony landmarks right here, and those are the sesamoid bones. And next we're going to do the metatarsal bones, and you're just going to put your index fingers on the dorsum of the foot and your thumbs on the plantar surface, and you just find the bones right in the middle of the foot here, and they connect to the phalanges right around here.
The zone 3 medial malleolus. So the deltoid ligament is going to be just inferior to the medial malleola, and it is not easy to palpate. If you evert the foot and press down, you should feel a little springy structure, and that's going to be the deltoid ligament. So to find the tibialis posterior tendon, you're going to have the patient invert and plantar flex their foot. And from the medial malleolus, you're going to palpate the soft tissue depression between the posterior aspect and the Achilles tendon. And it's going to run underneath and up your The flexor digitorum longus tendon is going to be just behind the tibialis posterior. And it's going to be slightly above the malleolus, so it's going to run up this way. The flexor hallucis longus tendon can't be palpated unless it's symptomatic, but it's going to run along the posterior aspect of the tibia and grooves the posterior aspect of the talus. And the posterior tibial artery is going to be between the tendons of the flexor digitorum longus and the flexor hallucis longus. So the foot should be relaxed and non-weight bearing, and it's going to run right along here. So the tibial nerve is going to be posterior and lateral to the posterior tibial artery, and it's going to be difficult to palpate unless it's symptomatic, and it runs right along here.
And now I'm going to palpate the dorsum side of the foot between the two malleoli. So what you're going to do, there's going to be three tendons on the top of the foot that we're going to palpate. You're going to have the patient dorsiflex and invert the foot against resistance. The most prominent one's going to be right here, and that's going to be your tibialis anterior tendon. You're going to palpate that down to its insertion on the medial aspect of the base of the first metatarsal. The extensor hallucis longus tendon, you're going to keep them in this position, but ask them to extend their big toe. And it's going to be more medial to the tibialis anterior tendon, and you're going to follow that down to the base of the big toe. The extensor digitorum longus tendon, you're going to keep them in the same position, but ask them to extend their four toes out here. It's going to run right here, and you're going to palpate it down to it. It's going to split into four, going to each toe. The dorsal pedal artery is in between the extensor hallucis longus tendon and the extensor digitorum longus right here in the middle. Is the lateral malleolus palpations. First, we're going to do the anterior talofibular ligament. You're going to have your patient invert and plantar flex their foot. The anterior talofibular ligament runs inferior to the lateral malleolus, and it's most easily palpated in the sinus tarsi. It's kind of difficult to palpate, but it is able to palpate if there's a defect in it. The calcaneofibular ligament, it goes planarward, so from the inferior aspect of the lateral malleolus and inserts on the calcaneus. The posterior talofibular ligament is going to run from the posterior aspect of the lateral malleolus to the posterior aspect of the talus. So the peroneus longus and brevis tendons, you're going to have the patient actively evert and plantar flex the foot. It's going to be this right here. This is the peroneal tendon. It's going to come down here and split into two. The one that goes more planarward is going to be the peroneus longus, and the one that goes more this way anteriorly is going to be peroneus brevis.
We're going to do the landmarks of the calcaneus. All right, we're going to start with the retrocalcaneal bursa. And it lies between the Achilles tendon and the calcaneus, the dome of the calcaneus. So you're going to find the Achilles tendon right around here, and you're going to find the dome of the calcaneus. And you're just going to move a little bit inward, and right there is where the retrocalcaneal bursa is. And then we'll just move our fingers outward superficially, and it's between the Achilles tendon and overlying skin, and that is the calcaneus bursa. And now I'm going to palpate the plantar surface of the foot. The only landmark that we'll be finding is the plantar aponeurosis or plantar fascia, and you're just going to find the medial tuberosity of the calcaneus, and the plantar fascia just splays out down the plantar side of the foot, right around here.